Hello, this is Health Hinge with Dr. Oduor. Welcome to this space. Today I'll be talking about daily routine to control blood pressure, the simple habits that work. I'll be emphasizing on if you're taking blood pressure medication but your numbers are still high. This video is for you. These are some of the quick hints that can help you achieve the control of blood pressure. High blood pressure is not controlled by drugs alone. What you do daily matters more than occasional clinic visits. In the next 10 minutes, I'll show you a simple daily routine that helps control blood pressure naturally and safely. Why blood pressure goes up daily is because of the following. Stress. Stress is a situation where now you are unsettled the whole day, and now that will affect your blood pressure. Number 2 is salt. What you are taking every day, if it has a lot of salt. Number 3 is poor sleep. Poor sleep can affect your blood pressure. Physical inactivity is number 4. Skipping medication or taking them irregularly, that's also a way of not to control your blood pressure well. You take medicine in the morning but spend the whole day stressed, seated, eating salty foods, your blood pressure will still rise. So these are some of the routines you need to do. What do you do when you're waking up? Wake up at the same time daily. Avoid checking blood pressure immediately after waking up. It will give you a false high reading. Number 2 is medication consistency. Take blood pressure medication same time every day. Don't skip because you feel fine. Healthy breakfast choices also matter a lot. And in your breakfast, I know that in Africa here, oats may not be readily accessible, but that is one way of having a good breakfast. Fruits, banana is the best. Boiled eggs, not fried, is another best meal in the morning. Black tea without sweetening, that's another way. Avoid the following in your breakfasts: sausages, mandazi daily, processed meats. Those are things to avoid. Please take note of those if you have high blood pressure and it's not well controlled. Daytime routine. This is where main people fail. You need to be moving at least 30 minutes every day. You can break them into 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. So moving around during daytime is very, very key. And I don't want you to fail in doing that. So you do not need a gym. Walking is what can work. Salt control. Avoid adding salt at the table, or reduce the following: processed snacks, which are known to have a lot of salt, too much stock cubes. Packaged foods also have a lot of salt. Once you avoid those, then you are doing well in terms of salt control. I can give you this as a tip. If food tastes okay without adding salt, please don't add it. That's a very better way of avoiding salt. Stress and mental health routine is very key also in controlling your blood pressure. Stress directly raises your blood pressure hormones. So daily stress control ideas are as follows: deep breathing, at least 2 minutes of deep breathing. Short prayer or meditation sessions are very key if you are a prayerful person. Music can help you relax. Avoid unnecessary arguments. So here, if you want to also, you can't control life stress, but you can control how your body reacts quite often by doing those habits. Your evening routine can include the following: dinner timing. Eat at least 2 to 3 hours before sleep. Light meals will be very important here, and the meals should have vegetables, small portions of ugali or rice, fish or beans. Those are very, very key. Avoid the following: heavy late night meals or alcohol in the evenings if you have high blood pressure. Your sleep routine should aim at least 7 to 8 hours of sleep. Poor sleep equals to high blood pressure. And another important thing is that reduce phone use before bed. So the following should be also important: quiet, dark sleeping environment will also help improve blood pressure control. So people with untreated sleep problems often struggle to control their blood pressure. That's something that you need to take note of as well. So some of the weekly and monthly habits: please check your blood pressure 2 to 3 times a week, not obsessively. And keep a blood pressure record, and also do clinic follow-ups. Never stop medication on your own. And this is very important. If we're going to do this, normal readings don't mean you are cured. All you need to know is that there can be normal readings, and if you stop medication, your blood pressure will shoot. So blood pressure is controlled by what you do every single day, not once in a while. That is very, very important to take note of. So you can like, you can subscribe, you can comment in the comments section. But important thing is that when you want to control your blood pressure, which habit will you start today? That's a question I'm posing to you. So consistency beats medication changes. Small habits and big blood pressure control will be realized. So lifestyle is treatment of blood pressure, not the other way like people think, that it's medication that control blood pressure. Thank you for watching.